I'm Dr. Jibu Varghese, and my position is a consultant dermatologist and also skin cancer specialist. So I work in four different clinics and also do NHS clinics as part of my work. I became a doctor because I found medical profession most fascinating, not just the scientific aspect of medicine and also the changing aspects of medicine, because medicine is a growing specialty and there is so much changes. And being a science student, I always had the inclination to know more about human body and various mechanisms of disease per se, and also the medication. But the most important reason why I took up medicine is because my reason to work with people, and I am a people person. I cannot imagine myself living in a desert island on my own. Yes, the reason I chose dermatology is because I was always interested in internal medicine. So internal medicine was an aspect that I enjoyed thoroughly during my junior doctor training and progressing further into foundation year training, etc. But however, during my training, I was placed in dermatology and I worked with this very good professor who explained the medicine and the science behind dermatology. And I found it very fascinating. And skin being the largest organ of the body and the varied presentation of skin disease. And the most important thing that excited me the most is we can make a diagnosis of internal disease, that is a systemic illness, just by looking outwardly in the person. So by looking at the skin, we are able to come to some sort of assessment of the internal condition. So that is one of the greatest areas that fascinated me. The other thing, obviously, is the skin cancer and the surgical aspect. I not only, as I said, I like medicine, but I also like the hand-eye coordination. So I was basically good at the hand-eye coordination, and I like that aspect where you can remove a tumor completely, a skin cancer, and bring the skin together. So that was another aspect that really was very unique about dermatology. So you could not only be a physician, but you also a skin surgeon. The most rewarding thing I find in my job, there's no doubt, that makes a big difference to my day, is when I have started a patient who's very poorly and I've made a difference to their lives. I see some horrific, very badly managed in some ways, or in some ways their patients are so poorly because they have no access to doctors, and the COVID has not helped. Our GP colleagues are very busy and some of the patients are really in a bad way. And when I get to see them, they are completely in a state. And then the difference I can make to their lives is what is the most rewarding thing. I would go back every day to work for that reason. Yes, patients, there's no doubt they come with various disorders or different conditions, and they all are different, very different. All patients are different, and their expectations are different. So patients do expect, obviously, from me is that they get a clear explanation of their condition and they develop a trust. And that is what I find most important uh, with chronic skin conditions, even any skin condition. When I see a patient, they like to know clearly what was the diagnosis, and I've explained it clearly to them. So I make an effort so that they have understood everything I've said. Then I back it up with some available literature or sometimes even videos. I show my patients videos of the condition so that they understand exactly what I've said. And I show a lot of pictures, because in dermatology, that's another very interesting specialty, because we can show pictures to patients. Unlike being say, a kidney specialist, you can't show much pictures. But here we can show pictures to patients and make sure that they've understood what I'm trying to say. And I find that really very important aspect of patient care. Now, as a doctor, this is what I would like to do, is a better communication so that my patients clearly understand what I'm talking to them and they get a clear treatment plan. So I also personalize some of the letters in simple layman's language so that Mr. X or Y can understand what treatment plan was devised, what is our plan ahead in the coming weeks, how we plan and how we expect the response to treatment. So a tailor-made letter, very specific to my patients. This is not the letter that I sent to the GP colleague, which is very lots of medical terminology and medical jargon. So I tailor a letter specific to my patients so that they understand that very clearly. Now, expectations from my patients, I do expect my patients to tell me clearly what is their condition. So when they meet, they are able to say, not to say exactly, give me a clear history so that so they can help me to make the correct diagnosis. So my expectation from my patients are that they come to me with a clear illness, what is the condition, what they're worried most about, and if they've not understood anything, they can always feel free to stop me, ask me several questions. Even if something is not clear, I don't expect them to walk out feeling that, oh, I can't ask him a question. No, 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 no. I am the most transparent, and I would like my patients to stop and ask me, or they don't agree with something that I did, disagree, then we can go have a conversation together, maybe find the right approach or the best treatment for the patient.